Bismillah ar-Rahman ar-Rahim. The paper is healing of 295 endodontic microsurgery cases after long term 5 to 9 years versus middle term 1 to 4 years follow-up. The paper was published in JOE in June 2022. The main author is Antonio Serrano from University of Valencia and other colleagues. They are looking by the success of periapical surgery over time 1 to 4 years versus 5 to 9 years. I'm going through introduction. The endodontic microsurgery is characterized by a success rate of 90% to 94% after approximately 1 to 2 years of follow-up, and the healing rate might decrease to 78% to 81% after 5 to 9 years of follow-up. The prognosis of an endodontic microsurgery can be influenced by the number of variables and type and location of the tooth or type of coronal restoration which was involved. So the purpose of this study to compare the healing after endodontic microsurgery over long term 5 to 9 years versus middle term 1 to 4 years follow-up and assess the influence of different healing over the time. The material and method of this study, they did retrospective study was made comparing the endodontic microsurgery healing rate after 1 to 4 years versus 5 to 9 years of follow-up. A total of 332 patients, which was divided by 60% women and 40% men, were included in this study. The 332 analyzed teeth, which was 198, were subjected to middle term follow-up from 1 to 4 years, and while 134 patients were subjected to the long-term follow-up from 5 to 9 years. All patients signed and confirmed. 2 surgeons performed all the operation using dental surgical microscope and endoscope following the methodology of von Erters, which was 5 years longitudinal assessment of prognosis of apical microsurgery. After that, they started under irrigation with sterile saline solution, used a marginal incision was made, full thickness flap was raised, and osteotomy was performed. The apical portion of the tooth was resected 3 mm of perpendicular to the long axis of the tooth, and methyl blue staining was used when root fracture was suspected. The retrograde cavity was prepared to the depth of 3 mm using ultrasonic, followed by retrograde filling with MTA, and pressure-free flap suturing was carried out using 6-0 sutural material. The patient returned for control visit 1 month after endodontic microsurgery to assess the healing, and again after 6 months to evaluate the presence of sign and symptom. And they did the data collection of the patient were subjected to the clinical evaluation to observing the presence of symptom such as pain, sensitivity, and response to percussion and palpitation, and they did sign such as fistula or swelling. And from case of history of periapical radiograph, which was entered the database, such as age less than 45 years versus above 45 years, and the time of endodontic microsurgery, and the type of the tooth, which is anterior, premolar, molar, maxillary, or mandibular, previous and apical extent of previous root canal filling, and presence of both type of restoration versus a crown, and interproximal bone level, and they did the radiographic healing around the treated teeth, which was classified into 4 groups according to the criteria of Rudd and Molvin, which is complete healing, incomplete healing, uncertain healing, or unsatisfactory healing, and they did statistic analysis were used odd ratio. So the result of this study, there was no statistically significant difference in term gender, age, type, and size of the tooth, and lesion and or apical extent of previous root canal filling, or presence of post restoration or type of restoration, and 2 statistically significant association at cohort or interproximal bone level. The p-value was above 0.05. So the conclusion of this study was The success rate of 86% was recorded after 1 to 4 years of follow-up versus 76% after 5 to 9 years. The shortest follow-up cohort study was from 1 to 4 years, and the healing rate was 92% versus 82% in the cohort with longer follow-up cases after 5 to 9 years. The prognosis was influenced by crystal bone level in relation to cemento-enamel junction of the tooth, and the significantly poor when proben depth was 3 mm mesial or distal to the treated teeth. Thank you.